Hey, I think we are ready to go. So thank you everyone for joining us today for our webinar, Living Well with Dementia, the Impact of Physical Activity and Nutrition, hosted by Dr. Laura Middleton, Dr. Carrie McAiney, and Sian Lockwood. My name is Vanessa Vucci-Terabassi, and I'm a project manager at the Research Institute for Aging. I'm going to start off our webinar by acknowledging the land that we at the RIA occupy. We work on the traditional territory of the Attawandaron, Anishinaabe, and Haudenosaunee peoples. The RIA is situated on the Haldeman Tract, the land promised to the Six Nations that includes 6 miles on each side of the Grand River. We're going to take a brief moment of silence for you to reflect on the land where you live and work today. But before I introduce our speakers, there are a few housekeeping topics I'd like to cover briefly. First, as you are notified, this webinar is being recorded. We will be sharing the link with you by email after the event, and we welcome you to revisit the content yourself and share it with colleagues. The slide deck will not be shared. We also invite your comments and questions. Please look at the Q&A chat box on your screen, and if you think of a question for the speakers at any point, just type it in there and we will pose it to the speakers for the discussion portion at the end of the event. Lastly, please take a moment to add your role in the chat box. This could be a person living with dementia, a care partner, a healthcare professional, a community service provider, or other. So before I turn it over, I want to tell you a little bit about our speakers. Today's presenters are Laura, Carrie, Sian, Christine, and Myrna. Laura Middleton is an associate professor in the Department of Kinesiology and Health Sciences at the University of Waterloo, and Schlegel Research Chair in Dementia and Active Living at the Schlegel-UW Research Institute for Aging. Her research aims to identify strategies to promote health, well-being, and function of those living with or at risk for dementia. Her research takes a participatory approach, and she focuses on the role of activity alone or in combination with healthy eating and social engagement, recognizing their broad impact on cognitive, physical, social, and mental well-being. Carrie McAiney is an associate professor in the School of Public Health Sciences at the University of Waterloo and Schlegel Research Chair in Dementia and scientific director of the Murray Alzheimer Research and Education Program at the Schlegel-UW Research Institute for Aging. Carrie's research involves working collaboratively with persons living with dementia and family care partners to develop and evaluate approaches to enhance their well-being. Sian Lockwood is a Knowledge Transfer and Exchange Associate at the Alzheimer's Society of Canada, where she co-develops knowledge translation and exchange tools and resources that provide information and education for people living with dementia, care partners, and healthcare providers. Sian holds a Bachelor of Psychology and a Master Library in Information Science. She previously worked at the Schlegel-UW Research Institute for Aging, Alzheimer's Society of UK, and the Partnerships in Dementia Care Alliance at the University of Waterloo. Christine Aiken is from Chilliwack, BC, and she describes herself as bright, fun, and adventurous. Her sense of humor has grown since her diagnosis of vascular dementia and cerebrovascular disease. Her motto since being diagnosed is, "I'm not done yet." Christine worked for the Ontario Health Authority for 13 years in various sites. Her most loved work was in dementia care, where she advocated for families, patients, and for better training of workers. Christine is still advocating and using her voice to try to help others and to try to end the stigma. Myrna Norman lives in Maple Ridge, BC, and after she was diagnosed in 2019 with frontal temporal dementia, feeling total and absolute despair, her daughter Sherry explained to her, "It is what it is." At that moment, Myrna decided to become educated in neurocognitive disorders and to become an advocate. Myrna's advocacy is far-reaching as she speaks on this topic with the Purple Angel Ambassadors, the Alzheimer's Society of BC, various churches, and staff and residents of retirement and long-term care homes. So at this time, I'm going to hand it over to Laura, who will start today's presentation.
Thank you everyone so much for coming today. It is my pleasure to work with and present with this wonderful panel of speakers, especially Christine and Myrna, who are such powerful voices for change and just wonderful women all around. So I know many of you will already be acquainted with the state of dementia in Canada. There are approximately 700,000 people living with dementia in Canada today, and this number is expected to reach over 1.5 million by 25 years from now. Now, I don't say this to set alarm, but simply to say that we need to build capacity to prevent dementia where we can and improve the quality of life of people living with dementia, both inside the healthcare system, but also outside of the healthcare system. And so it was timely that Canada finally had their first national dementia strategy launched in 2019. The three main objectives under this strategy are: 1, to prevent dementia; 2, to advance therapies and find a cure; and 3, to improve the quality of life of people living with dementia and their care partners. Now, we would all like to see all potential cases of dementia prevented where we can and find a cure in the coming decades. Nonetheless, we expect to see people to continue to live with dementia over the coming years. And it's our responsibility to improve the conditions where often the current status is people take many years for a diagnosis and are sent home with few supports. And so this last objective, improving the quality of life of people living with dementia, is the focus of our webinar today. Now, there was a large study out of University of Exeter that engaged over 1,000 people living with dementia and care partners. Their aim was to identify what helps people to live well with dementia, and they found a few core elements that predicted people who identified as living better. 1, psychological features, certainly personality, having optimism, having confidence, managing to avoid mental health conditions like depression, having good physical fitness, function, and health, whether that is your ability to walk, see, or sleep well. Having good resources such as social networks and cultural supports. Your ability to manage everyday life as independently as possible or with the support of others. And finally, social situation, your economics, your education, the standing in your community. Now, the interventions we'll talk about today will primarily focus on these two elements that certainly can be modified: your physical fitness and health, as well as your ability to manage everyday life. Your physical abilities and your functional abilities and your independence, as well as quality of life, are two outcomes that are consistently identified as important to people living with dementia and their families. Now, we need to identify strategies to improve these outcomes. While healthy lifestyle factors, such as physical activity and healthy eating, are a focus of research to reduce the risk of dementia, there's been less research that has focused on how well healthy lifestyle can impact how well a person lives with dementia. We need to understand more about the benefits and indeed whether there's a most effective type or dose of physical activity and healthy eating, and how interventions should be delivered to be most effective. And so our aim in doing this research project was to summarize all the research that's related to the effectiveness of either physical activity interventions or nutrition interventions on either the functional abilities of people living with dementia or quality of life. And we focused here specifically on people living with dementia in the community, because the types of interventions that focus on people in the community versus long-term care are often quite different. Now I'm going to hand it over to Carrie, Myrna, and Christine here to give us a little context about the importance of this work from the perspective of people with lived experience of dementia.
Great. Thanks so much, Laura. And I'll just wait for Christine and Myrna to come on the screen so everyone can see them. There's Christine and there's Myrna. Great. So Laura's giving us a really great introduction to, why we focused on this work. And, a lot of that focused on the research that's been done, but we would like to hear from you as to, why you think it's important to look at physical activity and nutrition for people living with dementia. Not sure who might want to go first.
I'll go
Myrna?
first. Sure. So I was diagnosed actually in 2009, which is a very long time, and have gone through 3 different dementia diagnoses. And now I've gotten to the point of MCI. So I still have some thinking difficulties, but I put all this down to not only listening to what you're telling us, but taking part. If when I had been originally diagnosed, instead of the doctor saying, go home, get your affairs in order, you have 5 to 8 years left to live, if he would have said to me, Myrna, this could be difficult for you, and here are some ideas. I've got a pamphlet on nutrition. I've got a pamphlet on physical activities you might want to take in, and also stay social. These would have made a huge difference for me 18 years ago. But at least I have them now, and I facilitate groups for people with lived experience, and we do what you guys are suggesting, and people are feeling better. Thank you, thank you.
Thank you, Myrna. Christine.
I sort of echo what Myrna said. I will add to that. My diagnosis is vascular dementia, and I was diagnosed 11 or I don't know, some years ago now, somewhere back there. And so for me, the physical activity and the nutrition side is vital. And my first number of years was a real struggle to access the information that was going to help me in that regard. It was really hard to find. Once I learned about those pieces and how important they were to me, and I was able to incorporate them, I have far exceeded what the expectation was for me. And now my doctor says at this moment in time, I am better than I have been in 20 years. Do I struggle cognitively in different ways? Yes. Does my dementia create challenges? Yes. But I have the understanding. That understanding wasn't available to me when I was diagnosed. So getting that to people so they have a better understanding is the most important component, I think. And the social aspect, not isolating away and being afraid to share your diagnosis, is the other piece. Because once you become socially isolated, all of those other pieces, the nutrition, worrying about your sleep, all of those things get affected. So we have to be socially engaged, right?
Absolutely. And you both talk about that access, right? So getting that information and, at the time of a diagnosis of dementia, it's, as you've talked about, it's pretty overwhelming. And so having physicians and other healthcare providers who are able to, give some advice, some insight, some, resources that, you could then follow and look into a little bit more detail is really critical. And I know Laura often talks about the fact that, for people, we talk about how do we prevent dementia a lot, and that includes things like being physically active and eating well and socially connected. And then, but there seems, as she says, to be this invisible line that once you get a diagnosis, it's almost like those things don't matter anymore. And that's you know, we think that's pretty crazy. They do absolutely matter. And the two of you have just spoken to that.
Yeah, exactly.
And
Well,
go ahead, Myrna.
I was just going to say that in a recent video that's come out, one of the doctors said, what's good for your heart's good for your brain. And isn't that the truth?
Absolutely. Yeah.
Yeah. And I think that so often people, when you're given that diagnosis and you're not given the knowledge of what you can do to help yourself, you can spend years in a really dark place trying to figure out how to get out of it. And by then, how much damage has been done that could be prevented if we were giving people what they needed right at the start.
Absolutely. So I think this is a, you know, a really good point of emphasis, that it's not only the literature, the research literature that's telling us, you know, that nutrition and physical activity are important. We're hearing it from the two of you. And the earlier that information and that knowledge comes to people with dementia, the better it is. So I think we will now turn it back over to Laura for the next part of the presentation.
Excellent. Thank you so much, everyone, to the both of you for your powerful words and really grounding the need. Not only, I think it's important not only to do the research, but that this message gets through to people, you know, at the time of their diagnosis or very shortly thereafter. And so our work here that we're talking about wasn't a new research study, so to say, but our goal was to summarize all the published research that examined physical activity or nutrition interventions on these outcomes of interest. So functional abilities, quality of life, or in the case of nutrition interventions, nutritional status, because we know that nutritional status predicts your functional abilities, predicts your likelihood of being frail, and predicts other elements and other health conditions. Here, often research studies, individual research studies remain unpublished or not reaching not unpublished, but they don't reach the public. And so here we wanted to gather all the research together to come up with a core messages that we could share with the public and people who support people living with dementia. So what did we do? Well, we searched all the published research for articles that included physical activity or nutrition interventions. And we started with almost 6,000 studies. So credit definitely goes to our team, our larger team, for going through all these studies. The first step was to review the titles and abstracts to see if they were relevant. That got us down to just under 300 studies. All of those were reviewed in full text. Vanessa, I would like to credit here, and Grace and the rest of the team. And all of that was narrowed down to 90 studies at the end that were eligible and included in this summary of literature. Now, a lot more of these were physical activity studies in comparison to nutrition trials. So you can see of those 90 studies, 84 were about physical activity. 41 of these are what we called controlled trials. So there was an intervention arm as well as a control arm that did not receive physical activity. And that's valuable because sometimes people's functional abilities or quality of life will change over time for reasons outside of physical activity. So by having this control arm, it means we have a comparison group. Now, the results we'll talk about today will focus on these controlled studies, these highest quality studies. We also found 43 studies that only had an intervention group, and these will be used more to understand subtleties in delivery and identify gaps where we need higher quality studies in the future. Now, what did we find related to physical activity? Well, amongst people living with dementia in the community, physical activity improved functional independence in activities of daily living. So those are things from really basic activities like getting dressed, eating, to what we call instrumental activities of daily living, which may be, cooking, it may be looking after finances, telephone calls. We also saw improvements in immediate assessments of physical function. So your endurance, your lower body strength, and your balance. And of course, all of these contribute to your functional independence, whether you're living with dementia or not. Now, we did not see an improvement in the quality of life of people living with dementia. And it is possible that physical activity interventions don't have an impact on quality of life. But there are some complications here. One, there was a lot fewer of these studies, I think only a handful of studies that examined the impact of the physical activity interventions on quality of life. So we need more research. Also, the quality of life measures that we use aren't necessarily capturing really meaningful parts of quality of life. They often measure, your mood and say, have you experienced poor mood or frustration on a daily basis or in the last week, or how are your functional or cognitive abilities change? But in most cases, people won't say that they were perfect in these aspects. They'll say they have at least some problems. So it's harder to measure changes. Now, we talked about at the beginning that we were looking for the best type of physical activity. Now, the complication is when we compared by different types or the setting of the intervention or the type of dementia, we didn't find any differences. So it would seem to be fairly consistent across the types of physical activity. Now, that said, there was a lot of shared characteristics about these physical activity interventions. For example, almost all the interventions included more than one type of exercise. All of the interventions were supervised by a trained professional, so they weren't done independently. So what were our conclusions here? Well, one, we recommend physical activity to improve the physical function and functional independence of people living with dementia. These are really important outcomes that predict whether you will need additional supports, whether in the home or in long-term care in the future. So it should be a focus of practice as well as policy. Though we didn't find dose effects, we do recommend physical activity that is consistent with the studies that were done. And so I'll give you a little bit of detail there. So we recommend physical activity that includes aerobic exercise, strength training, and balance exercise. It should be done at least a moderate intensity. What this means for those of you not familiar with monitoring is that it should be hard enough that you feel your breathing rate go up, that you get hotter, your heart rate is beating faster. You should, though, still be able to talk, even if with a bit more difficulty, but you shouldn't be able to sing. Then it's too light. Of course, doing more vigorous activity is also beneficial, but not critical. You should exercise or be physically active at least 2 to 3 times a week. And you should work up to at least 45 to 60 minutes per session, understanding that everyone's going to start at a different point. Furthermore, especially as you progress in your dementia journey, you can benefit by having supervision by a trained leader. It doesn't matter whether it's in a one-to-one or group format. It can help increase your motivation, make sure your intensity is appropriate and that you're doing it safely. To find out more about our physical activity findings, we do have a handout that we developed that we hope will be shared with people after diagnosis. It tells about how physical activity can benefit people living with dementia and how to get started and what's recommended. You can find this on our Dementia Wellness website under projects and the latest evidence. Now I'll go on now to our evidence, what we found from about healthy eating. Now, first, we only identified 6 studies that evaluated nutrition intervention. So immediately you can see that the base of research is much smaller. There was 2 studies that were quite large. So over to, almost 950 and then over 200 participants. And then there were 4 smaller studies. You can see that this last one was really a pilot study to see if they could do the intervention rather than get results. So I would treat this evidence with a little bit more caution, but there are still some important results. First, what was done? Well, all nutrition interventions included education and information for care partners. Most of these studies also included coaching for the care partner, counseling, or some other type of individualization so that the advice wasn't just generic education about healthy eating, but was really looking at what they needed. One larger study had clinicians screen the patients in their practice and refer appropriate people to the nutritional intervention. So it was integrating this referral to nutrition services within regular clinical practice, which we think is really important. Now, the complication is that there were only 1 or 2 studies that measured each of quality of life and functional abilities. Given these results, and that many of the studies were very small, it's not possible to make conclusions about the effectiveness of nutrition interventions on these outcomes. However, nutritional status was assessed in 5 studies using what we call the mini nutritional assessment. The largest, highest quality studies, so those 2 big ones, showed improvement. Well, what we say the significance of the changes in the smaller studies wasn't enough to be confident in those studies themselves. They did show improvement in the direction of improvement as well. So we concluded at the end of it that these nutritional interventions seem to improve nutritional status of people living with dementia. And so what we recommend at the end of this is that healthy eating and nutritional programs and services should be made available to people with dementia who are at malnutrition risk. So those who are either having weight loss or having some eating challenges aren't able to consume what you need. Beneficial interventions may include education and information about healthy eating, as well as individual support for the family care partners or the person with dementia as well. The topics may include healthy eating, food preparation techniques, ways to increase protein and energy intake, which can be a challenge with dementia, as well as strategies to overcome eating challenges at meal times. And so there's a few ways that we would like to see this implemented. One, ideally, healthcare professionals would screen people living with dementia for nutrition risk. There's a couple really short tools that they could use for this purpose, and we list those in our resources that I'll introduce in a moment. People with dementia who are at nutrition risk should be referred to suitable supports. In addition to community programs and services, these may or perhaps should include referral to dietitians that can give individualized healthy eating suggestions, as well as speech language pathologists that can tackle issues with swallowing and eating more broadly. So those physical challenges that people living with dementia may experience. Now, after discussions with our research team, including Christine and Myrna and Carrie and Vanessa, we developed 2 different resources related to nutrition and healthy eating. One is targeted to people living with dementia and care partners or other supporters. And this gives advice on how to find supports for nutrition and eating. Again, these can be found at the dementiawellness.com website under projects and latest evidence. We also developed a resource specifically for healthcare professionals, especially those who are seeing people living with dementia as part of primary practice. And this both gives information on how to screen people living with dementia, but can also be posted as a prompt to get those primary health practitioners to screen people living with dementia so that they do get the support they need where appropriate and where they should refer on to. Again, if you're a healthcare professional or want to share this with your healthcare professional, this can also be found on dementiawellness.com. Now I'll hand over back to Carrie to discuss with Myrna and Christine some of these findings and how they align with their experience.
Great. Thanks so much, Laura. Again, just we'll wait for Christine and Myrna to come on screen. Here's Myrna and Christine. Excellent. So Myrna and Christine, Laura's provided a really helpful overview of the findings of the research that we did, the review of the literature on nutrition and on physical activity. And so I'm wondering, from your perspectives, what do you think of those results? Like, do they align with what, your experiences are? Is there anything that surprised you?
Go ahead, Christine.
It's interesting because at one point in my journey, I had to have a speech pathologist because I was having trouble with swallowing and speaking, eating, that kind of stuff. So it's interesting that that came out. I think it is an important piece. And I do agree that understanding which of the food groups feed your brain as well as the rest of your body is really important. We were a lot of us were brought up in a generation where all fats are bad for you and stay away from all this and this isn't good for you and that's not good for you, when in fact we're starving our bodies of some really vital nutrients. So, having the ability to give people that information can make a difference. It made a huge difference for me. It still does. I know as soon as my eating goes off track, I feel it. And then it shows in my cognition. It affects all aspects of my daily living and quality of life. So it's probably one of the most important, that and the physical side of it are probably the two most important pieces of my well-being.
Yeah, and sorry, go ahead, Myrna.
No, go ahead.
I was just going to say that, I think that there's more research that needs to be done as well in terms of what to eat. I think balance is the one message that we know. So, really try to have a balanced diet, follow the Canadian Food Guide. There's some evidence around the Mediterranean diet, but, that's not what we looked at in our research. So, I think there's, we have to be a little bit careful, but I think balance is a good message.
Well, and for me, part of it is understanding the difference between bad fat and healthy fat.
Yeah.
That I was shocked when I learned that side of it and the difference it makes.
Yes. Yeah.
Right. So those are components that were a surprise to me that I learned through my journey.
Yeah. And I think whenever we can get referrals to dietitians and as needed, as you said, Christine, speech language pathologists, that's a good thing. And I think that that's probably not something that's done as often as it should be.
Yeah, I agree.
Yeah. Myrna, what are your thoughts?
So a couple of interesting points. I've been making notes as Laura's been talking. Because I facilitate groups for people with dementia and care partners, I've been asked to include at least a 15-minute session of exercise They
Mhm.
came to me and said, like, we really need this. And so I think that's really important. I think the message is getting through. My other concern is when you guys did the quality, has this changed the quality of life? And you really didn't get much of a positive there. I think a lot of that is dependent on the time and the day that you might ask somebody with dementia. Um, and that's really important to take into consideration when you're doing a study on people's quality of life, particularly dementia. The other thing is, so I'm in my 70s. When I grew up, meat and potatoes was the food that you cooked every day. And once you married, you did the same thing. And it's only recently that we're learning we don't have to eat meat every day. We don't have to eat red meat more than once a week. We're learning slowly that change is good, and sometimes change is difficult for people to actually involve themselves in. My other point is about finding things that people really want to do in terms of physical activity. If I ask our fellows to take part in any kind of a craft situation, they are more than hesitant. They frankly don't want to do it. They want to do physical activities. And I think that's really, really important. And it kind of answers to what you and Laura have said about the importance of that. And I think the guys inherently know that exercise not only is fun, but good for them. And I think sometimes as facilitators, we use what we think is right instead of asking people with dementia what they want.
Mm-hmm.
Oh, I'll top that too, Myrna, because, so often you can go to a support group, for example, because it's good for us. We sit in a room, they ask, how's everybody doing? Instead of, what would everyone like to do? Maybe they want to go for a walk. Maybe they want to do, why are we putting everybody where they're just sitting around a table instead of getting them active, getting them engaged? And while you're doing that, the information that will come bubbling out of conversations that end up happening is amazing, right? You'll get more that way, and you're helping more than putting people just in a room to converse and then everybody feels better because, well, we've had a support group for them.
I think one of the things that you both have touched on is the idea of dementia being really individual and individualized, right? And the experience is different for every person, like when we're all unique individuals. And so, what's going to sort of feed our soul best is, potentially going to be different from person to person. So it's so important to ask people living with dementia what it is that they not only need, but what they want to do in different kinds of circumstances. And Myrna, you talked about the men in some of the groups you work with, like even the type of physical activity that people want to do, because we're seeing from this evidence that we've generated that it's important to our physical function and our level of independence to be physically active. But if you try to force somebody to do something that they don't enjoy, well, that's pretty useless, right? They're not going to continue to do it, and that goes against everything that we want, and we're finding from this research. So talk to people, ask them, tailor interventions or services and supports to individuals with dementia and what they want.
Mm-hmm.
And I just wanted to highlight again, Myrna, your comments about quality of life. And it's a really hard thing to measure. And you talked about thinking of the time of day and other factors that might come into play in terms of a person's quality of life. And I think one of the things that we've seen is that, and Laura mentioned this too, the measures that we have to assess quality of life are probably not the best. And they're not able to pick up on some of those things that are really important to people and where we're seeing some change. And so we need to do some more work in that area as well, so that we can pick up those, have measurements, assessments that could pick up some of those changes.
Mhm.
Yeah, I think too, like, I know for myself, like, I'm very physically active and strong. And I get really tired of people telling me that because of my medical stuff, I need to rest more and I need to sit down. And no, I don't. No, please let me do it at what I think I can manage, and I'll sit down and rest when I need to. But, you know, I always say I don't expect anybody to keep up to what I'm doing, but I need to do enough that I'm feeling at my best.
Yeah,
Right?
exactly.
Trying to get people to understand that just because you have certain challenges doesn't mean you are totally disabled from doing a lot of things, right?
Yep, absolutely. Okay, this has been super helpful to hear your perspectives on this, research findings that we've got. I'm going to remind people that are listening that you can add any questions that you have in the Q&A box at the bottom of your screen. And now I'm going to turn it over to Sian Lockwood from the Alzheimer's Society of Canada.
Thanks, Carrie. So every day, Alzheimer's Society programs and services staff connect with people with lived experience of dementia, as it's often challenging for people to know where to find reliable information on nutrition and physical activity. We often receive questions about the best types of nutrition and physical activity for people living with dementia to help them live well and improve their overall well-being. Our staff appreciate having up-to-date evidence-based resources that they can share with people living with dementia and care partners. And we've also heard from people living with dementia and care partners about their preference for accessible, plain language, evidence-based resources. They often express that these types of resources help them learn what they can do to improve their well-being. The resources created by this project team will support our staff as they provide programs and services to people with lived experience of dementia and also healthcare providers. They can easily be shared online or through programs, services, and events. And overall, we think they provide a quick and easy way to share valuable and practical information about nutrition and physical activity.
Thank you so much, Sian, for finishing off. It's really been a pleasure to work with the Alzheimer's Society, and hopefully together we'll be able to get these resources in the hands of more people soon after the diagnosis, like Christine and Myrna have both talked about. So people can have that empowerment, knowing that there's things that they can do to improve how well they're living, at the time of diagnosis, rather than, again, being sent home to plan for the end, which is not done as much, but still happens too often. I'm going to hand it over to Carrie, who's going to moderate our questions and answers. I see that we have one already, and I would like to say hi to Heather, who I know very well, so I'm glad she came today. Yeah, feel free to add additional questions to the Q&A window, please.
Thanks very much, Laura. And for folks, please, again, add any questions you might have into that Q&A box. So we have had a question, as Laura mentioned, from Heather McDonald. And this was a question for Christine and or Myrna. And Myrna's already typed in an answer, so we'll get her to share her response. But I'll first just share the question. because I'm not sure if everybody could see the questions, to be honest. So if you were presented with a person who is showing some I guess signs or suggestions that they're struggling with their memory and potentially you're wondering about dementia, but you don't know the person very well. They're more of an acquaintance, but you are quite concerned about them. What's an opening statement that you could make to sort of help potentially support the person? So Myrna, I'm wondering if you could
Sure.
kick us off.
If I remember what I wrote, I get people calling me frequently and asking me how they might bring the difficulty to the front. And, I try to think how I would like it to be handled from myself. And so if somebody came to me and made light conversation to begin with, and then if I was able to share part of my journey, particularly the better parts, but also to combine that with some of the negative parts, and let them know that there is a possibility to live well. There is an opportunity to learn about diet, about exercise, about staying social. And I would probably leave it at there, but ask them if we could talk again. And I'm sure they would say yes. And that's a really easy way to sort of bring it forward. I don't think sort of saying, I know you're having problems, can I help, is really the best foot forward.
Great, thanks, Myrna. So, excuse me, that idea of sort of easing into a conversation. Yeah. Christine, you added a comment as well. Would you like to share that?
Yeah, I think, so many times we end up talking to people, and first off, they're fearful of sharing the information. So if you share your own story first, it sort of makes them feel like I'm not alone, because that's what so many people feel, right? And then I always tell people, you can ask me anything. And I also tell them I won't sugarcoat things. Are there challenges? Yes. Are some days really rough? Yes. But here's the good side, right? I always say, my dementia was actually became like a silver lining in life for me. It brought me opportunities I didn't know were possible, friendships I never could have imagined, just a whole host of wonderful things. So I share that so that they can see there's much more than just the diagnosis. The diagnosis is just that, a diagnosis.
Yeah. That's great advice. Thank you to both of you. I now have a question I'll start with Laura, but then I want to move to Christine and Myrna as well. You talked about in the research that we've done, the importance of physical activity and the benefits it can have for people. But we know, there are some people that really haven't been very active, maybe at all, or not for quite a long time. And motivation can be quite challenging. And so, what can you do, or how can you try to motivate people to start? So Laura, maybe I'll start with you. And again, then I'll go to Christine and Myrna.
Yeah, I always say when I give talks about, whether it's in dementia prevention or people with dementia, I'll start with my two approaches are some people just want, a really specific prescription, like this is what I should do. I call that the brush your teeth approach because a neurologist that I know once said, the dentists have won and we have lost. People will brush their teeth every day, usually at least twice a day, or else they feel like they're dirty, that they're damaging their dental health. And people should feel the same way about physical activity, but we often don't. So if they, I mean, I can give a prescription for everyone, and I think it does need to be adjusted depending on what you've done in the past. But, you know, going for a walk, if you're able to, is a really fantastic way of getting exercise. Get outside, especially as we're getting into spring. You know, doing really simple strength exercises. You know, it can be, you know, the heavy duty gardening that Christine's probably doing at this time of year. It can be, you know, as simple as standing up out of the chair, getting down again, standing up. Like that's a strength training activity. Doing push-ups against a wall or a countertop. All of those are really valuable. So that's I can give you a prescription for the brush your teeth approach. And then the other that I kind of believe in, and partly, you know, well, Heather is someone I've rowed with who asked that question, but I love rowing. It's with people I enjoy. I get outside in nature. I like the movement on the water. So the other is like find something that you love. And that can, again, it can be going outside. It can be paddling. It can be being in a group exercise where you really like the activity, but try out different things and find someone you enjoy doing it with it. Having company and positive supports is one of the best predictors of being active. So if you have never been active, you know, start small, find someone who will encourage you and whose company you will enjoy doing it with, and work up from there. It doesn't have to be all at what we're recommending right away. Start in small steps and find something you can enjoy, because sometimes it's just seeing, you know, familiar people around a community center, even people you don't know well, but that sense of community can really build pleasure in getting out and being active too.
That's awesome. I hadn't heard the brush your teeth analogy, so I like that. Christine or Myrna, any thoughts on how, you know, if you were trying to motivate someone to be physically active or to eat well for that matter, anything that you would recommend?
For me, I think it's about, like I always tell people, I'm still here because I'm active and I do these things. And lots of them, people can go, why would you do that? For example, my husband and I go out in the backcountry and we spend a lot of hours out there. I stop, I walk. We pick up garbage and cans that people have tossed away. So we're cleaning up the environment. But it's more than that. It's exercise. It's movement. Is that what everybody wants to spend their free time doing? Absolutely not. But it's like Laura says, find that something that makes you feel good. You know, maybe you want to go down the street and take, you know, Aunt Sue that lives down there and walk with her up to the grocery store. Like, just find something that makes you feel good and start small. Start small.
Thanks, Christine. Myrna.
So for my many years of facilitating, they have taught me so much. So my folks, I know that's not even the right word, but my folks like to go out to the park. Guys that can hardly walk, guys that are on walkers, guys that are in severe pain will play bocce for 45 minutes. They love playing hoops. They love golf. I have some golf things that we can play with in our room where we have our things. So I'm going to repeat myself and I'm going to say, again, ask people, but make suggestions of things you might think who knew they would love to play hoops? I didn't know. And I found this great sort of soft basketball and a hoop that you can put up anywhere. They love it. We do this other game where we all go in a circle and we bounce the basketball to someone on the other side, but we have to use the person's name. So it's a cognitive exercise, a visual, people have to use their hands to like, it's amazing and they love it. So we have to give them the opportunity to do these things and Laura, you said it, outdoors. I mean, nature nurtures, and it's true. It works, and people love it.
Mhm.
Fantastic. And you know, it's interesting because other people that I've talked to as well, you know, they love to continue to do things that maybe they've done in the past. But also people talk about, you know, oh, I've never done this, but now I tried it and I really love it. And so
Yeah.
people can also engage in new exercises, new activities that maybe they haven't previously, and really find a lot of joy in those things. So I guess all possibilities are out there. Um, I know we're running close or to the end of our
Can I,
time, and Laura wants to jump in real quick before I made a couple.
I think I was going to ask Christina and Myrna a question, but I think I've run out of time, so I'll have to ask you offline. But I just want to add to that. I think that, you know, the achievement and the confidence you can get through physical activity is really valuable. I think Myrna put in the chat that at the beginning of her diagnosis, she couldn't walk up a long hill, right? And then you see that improvement. So in a condition that's often defined clinically by decline, like being able to improve and do things is really important. And it gives you confidence, yes, in the physical activity, but also elsewhere. I've heard of people who did a push-up for the first time in their lives, and that was incredibly empowering. People who said, "Oh, I could get back to doing archery." Is often unique. I didn't have to use my walker. I could high five because it was someone who had a stroke. I could high five again for the first time in 10 years, right? That these achievements and improvements that you can note, I think, are incredibly valuable and are an element of quality of life that isn't captured in the questionnaires.
Absolutely.
That said,
Thanks, Laura.
yeah.
I'm just going to mention one thing. Ian
Yeah.
asked if we could mention the active living programs that are offered by many Alzheimer's societies, such as Minds in Motion. So if you're looking for options to be physically active, the Alzheimer's societies will often have some things that are available.
Yes.
So.
Yeah, I would say that most Alzheimer's Society have Minds in Motion program, which is an exercise and social and mental stimulation program. Some have walking programs. I was looking at these in the Alzheimer's Society of Toronto, and we have been co-offering a new program that we developed called Delight, which offers physical activity along with shared learning about healthy eating, physical activity, sleep, mental well-being, and social connection in a number of different places. So that's, you can also find information about that on the Dementia Wellness website.
Can I just add something here quickly? One of the questions was about whether the physical and nutrition aspect impacts the cognitive side of things, the mood.
Yeah.
I would say absolutely 100% it does.
Yeah.
100%. If I'm not eating properly, I cognitively don't process things properly. And that impacts my overall quality of life and the ability to manage things the way I want to, in the way I want to. So it has a huge impact. Huge.
Thanks, Christine. Okay, I think I'm now going to turn it over to Vanessa, but thank you very much, Christine and Myrna, for sharing your fantastic insights. And it's just wonderful to hear you and to be inspired by both of you.
So I've just launched a poll, which should bring some questions on your screen. We would really appreciate if you could take a moment to answer those questions and give us your feedback. So thank you everyone who joined us for today's webinar. Before we close today's session, I want to thank Laura, Carrie, and Sian for their presentation. And I would also like to thank Christina and Myrna for sharing their personal experiences and insights to highlight the importance of this work. So thank you so much, everyone. And the link to the Dementia Wellness website is on the screen as well as in the chat. We hope that you take some time to check out the resources and share it with others who may be interested. And if you have any additional questions after the webinar or upon checking out the resources, you can reach out to the contact information on the slide. So thank you so much, everyone, and have a wonderful rest of your day. Goodbye.